Yes, thank you, Mayor. I would like to, I know you mentioned trends, and we're all looking for trends on how we're doing, or how well we're doing in terms of the masking and other things we're taking and mitigation measures we're taking. One of the questions that could help us understand whether or not we're doing a good job is the positivity rate. Is there a way we can get on a weekly basis a positivity rate? If we can't, tell me why we can't get that.
We're working on putting that metric out there. Now, unfortunately, like much in this pandemic, it's not as easy as it seems. Let me explain further what I mean. The positivity rate's calculated by the number of positive tests divided by the total number of tests given. The problem that we encounter is that positive tests are required to be reported within 24 hours. That's part of the nature of the urgency of that disease report. But what we're finding is that negative tests oftentimes take several weeks to be fully reported out. So what happens is that lack of negative test results end up skewing that number right out of the gate. Now, let me give you an example. We're confident that there was a 9.02 positivity rate for the week of August 9th through 15th. But early on in that week, that number was more than 25% because negative results weren't coming in through the state's reporting system. So 2 weeks later, it drops from 25% to 9%.
Okay.
And what we worry about is we're kind of stuck between a rock and a hard place. We put the data out real time, people panic. If we don't put the data out real time, people accuse us of hiding things. So I think we're trying to find ways that we can asterisk that data and continue to update it. But it's not really good actionable data until you have the full picture. And so that's the situation that we find ourselves stuck in.
So there's essentially a two-week lag between getting the negative back.
What we found is it takes up to 2 weeks before we really have a stable positivity rate. And you know, there are entities that are reporting it out real time, but that's still not a clear picture that we would rely on from an analytics perspective.
Now, based upon you said 2 weeks ago it would have been 25%, and you said now is you looked at those numbers based upon the negatives you received, it was 9%. Mm-hmm. Comparing that number, did you go back and see if we're trending up or down?
Definitely trending up. The week before we were about 4.5%.
Okay.
So it doubled in that time frame. And that is not necessarily surprising given what we've seen with case numbers. I would guess that we're somewhere in the 10% range right now.
Okay.